Welcome. Thank you for joining us today. I'm really delighted to be with all of you here. I'd like to remind everyone that you can put questions into the question box, and we're going to be reviewing that during the talk. We have two extraordinary leaders to set the scene today. First, we're going to hear from Professor John Reeder. He's the director of TDR, which is the Special Program for Research and Training in Tropical Diseases. He's also the director for research for health at the World Health Organization. And prior to this, he was director for the Center for Population Health at the Burnett Institute. And earlier, he led the Papua New Guinea Institute of Medical Research for many years. So without further ado, over to you, Professor Reeder.
Thanks, Joel, and welcome everybody to the seminar. Particularly welcome to our honored guest, Dr. Kiflay, the Minister of Education. I'm John Reeder, and I'm the director of TDR, as Joel said. And TDR has trained over 15,000 researchers across the world, especially in low middle income countries. It's really at the heart of what we do. For example, we're organizing at the moment massive online open courses on implementation research, and these provide training opportunities for emerging leaders, build capacity for research, and help to create an enabling environment for research. Mentorship is a key part of capacity building and training in research. Mentors are often the ones who convince us to enter a research career in the first place, the ones who provide skills and opportunities to thrive and sustain this life in research, and the ones who coach mentees to become mentors over time. In this way, mentorship becomes a virtuous cycle of giving and receiving. But how can research mentorship be enhanced in low middle income countries? There are several important structural barriers to institutionalizing research mentorship in diverse global settings and helping the next generation of scientists build their careers in research. First, there's a focus on the mentee-mentor relations that sometimes doesn't appreciate the broader context of mentorship. Second, many of our resources, evidence, and thinking to date have focused on research mentorship in high-income countries. And lastly, while there are increasing mentorship programs at LMIC institutions and a growing evidence base of strategies, tips, and resources to inform these responses where resources are very rare. So we really have to think about how we move this to benefit everybody and benefit the careers of everybody. TDR Global is the community of our trainees, grantees, and experts. In collaboration with SESH and ARI, we've developed an important practical guide called HERMES to fill this gap. For those of you wondering, HERMES stands for Health Research Mentorship in Low and Middle Income Countries. And HERMES brings together evidence from a scoping review of the literature alongside a global crowdsourcing open call. And it's been developed with input from researchers in practically all WHO regions. I'm delighted to be with you here today, and I'd really like to congratulate the team on this excellent practical guide. I invite you all to test it and see how it can help your institution strengthen its mentorship environment and build capacity for smooth knowledge transfer towards the next generation of scientists. I would really be happy to integrate your feedback in any next revision of this guideline. So thank you very much and enjoy the discussion. Back to you, Joe.
Thanks, Professor Reeder. Now I'd like to introduce our second speaker, Minister Samuel Kiflay. Minister Kiflay is the Ethiopian State Minister for Higher Education, and before that, he worked as a banker at the Ethiopian Development Bank. He was a lecturer at Yeoma University, and in civil service, he rose to Director General for the Higher Education Administration Affairs, and among various other assignments for the higher education development in Ethiopia and Africa more broadly. In 2021, this culminated in his being recognized as Africa's patriotic public servant. So thank you so much for joining us, Minister. Over to you.
Thank you very much. Dear Professor John Reeder, Director at TDR, colleagues, friends, and all in this call and attending this lounge. I'm very much delighted to join you for this health research mentorship in low and middle income countries. under the support of TDR in collaboration with AHARI, the Armor Hansa Research Institute in Ethiopia. And those of you contributing to this event and this launch, I sincerely thank you for the efforts you have been putting into this initiative. On the outset, I have to recognize the work that we've been doing in the past, and the mentorship, as Professor John Reader said, is cyclical, and that affects a host of generation. And one day a mentor was a mentee, and today's mentee are supposed to be mentors tomorrow. And this cycle has to continue, expanding its influence and scope. And furthermore, it has to expand the quality of the research that's taking place. In particular, to the tropical disease research, we have to collaborate, as this part of the world that is challenged with a number of issues, including the tropical specific diseases, and the research has to be very specific and very research data oriented, data informed, and very relevant to the problems. Because our world is almost becoming a village, any disease that emanates from the tropical area would affect the rest of the world. Now we are very much connected, both in terms of trade, also in terms of health problems and health related, public health related issues. Therefore, the research undertakings have to consider the available resources in the north and south, in the west and in the east, and this mentorship guide that is in preparation, that has been reviewed, would help affect the research quality, both in the academics and also in research institutes. From the university system in Ethiopia, we are expanding the higher education system. We have still thousands of miles to go, but the health institutes and the health colleges are in good shape relatively, and both in terms of the manpower as well as the research publications and research productivity. This mentorship would add to their existing capacity and would affect the quality of the research they undertake. AHARI's role in coordinating this and also doing the best of and coordinating the best minds in the country for conducting similar research areas, and particularly in the health area, would be very instrumental for the success of our academics and as well as the health sector, which would be very collaborative and would be very complementary. As a Ministry of Education, we have been differentiating the higher education system, as universities are now categorized into research, applied science, comprehensive, and science and technology. Those research universities would focus at the basic research as well as applied research, but mainly on graduate school study, graduate school research, and high-end research undertakings in the country. Collaborating with AHARI, as well as TDR and other international organizations like WHO, would be very helpful for our academia as well as for our health sector in general to the nation. With this note, I would like to wish you a very successful engagement today and a very good discussion and a productive one. If you allow me all, sincerely, I will ask an apology to leave this call immediately, because I'm coordinating the national exam, which is now being shipped to the exam centers, and I assure you that Ministry of Education will continue to support such initiatives and to collaborate and support all your engagements in the future as well. Thank you very much.
Thank you, Minister Kifle. It's really great to have you join us today. And our next speaker is going to be Dr. Lida Osorio. She's the chair of TDR Global. She's a physician, epidemiologist, and passionate advocate for mentorship. And she's not able to join us live, but she's generously pre-recorded a brief video. So over to you, Dr. Osorio. And can folks hear the audio?
Research mentoring in low and middle income countries, TDR practical guide. When we hear the word mentoring, we usually think of a person who has supported and provided key advice in our research careers. We feel grateful for having a mentor, want to give back and become mentors ourselves. Thus, mentoring is usually an endeavor between individuals rather than programs within academia or research institutions. The Health Research Mentoring in Low and Middle Income Countries, TDR Practical Guide, seeks to contribute to the institutionalization of health research mentoring programs by providing advice and tools covering the 4 stages of a research mentoring program's life cycle. This practical guide is sensitive to the particular characteristics of mentoring in LMIC. Now the invitation is for everyone to read this guide, to criticize it, adapt it, implement it, and provide feedback to us so TDR Global can continue improving this guideline. And together, we can facilitate that more health researchers can develop their careers while nurtured by health research mentoring programs. In the future, when we hear the word mentoring, we will think not only of a person, but of inclusive institutions.
Thank you, Dr. Osorio. Really a great reminder to be critical and to think about how we can improve this over time. So now we'd like to shift gears a little bit. We're going to hear about a scoping review of the literature on research mentorship. This was organized by Dr. Yosef Abraha. He's at the Ethiopian Public Health Institute, and he's going to review for us the findings from the scoping review. Over to you, Yosef.
Okay, thank you, Joe, for the introduction. Good morning, good afternoon. As Joe said, I am Yosef. I'm a researcher working on evidence synthesis at the Knowledge Translation Unit of the Ethiopian Public Health Institute, EPHI, which is the research wing of the Ministry of Health. And I will give you a brief presentation of the scoping review work, which was done to inform the WHO TDR practical guide on research mentorship, as it was mentioned before by Professor Joe Reeder. So, of course, in addition to the scoping review, open call and consensus meeting, we are also used to develop the practical guide, and it will be presented in detail by the next presenters, Dr. Ene and Dr. Murgisa. So my presentation will focus on the scoping review, which is entitled Health Research Mentorship in Low and Middle Income Countries. So I will go through the following contents or the following orders. So to start with the background information, though research mentorship is considered as a useful strategy to improve research capacities and related outcomes globally, it's not yet well developed in low and middle income countries or LMIC settings. And as Prof. John Reeder said before, much of the research evidence and guidelines related to the area on high income countries. So low and middle income countries have a scarcity of empirical evidence on research mentorship. And there is also a scarcity of effective strategy to institutionalize research mentorship. And there's also no practical guide considering the LMIC settings. Besides to this, there is limited available evidence, and that limited available evidence related to health research mentorship in LMIs is not well mapped and not well documented. Therefore, we undertook a scoping review to map and document the existing evidence in LMIs and to help the development of the practical guide for the setting, that means for the LMIC setting. And more specifically, the objects of the scoping review were to identify and map the evidence related to research mentorship experiences within the LMICs, and to identify the barriers of research mentorship, and to identify the strategies that enhance research mentorship in LMIC settings. When I come to the methods section, the scoping review was conducted following the Joanna Briggs Institute or JBI methodology for scoping reviews, and it was reported using the Prisma for scoping reviews. And it was done based on a priori protocol, which was registered on Open Science Framework. And when I come to the inclusion criteria of the scoping review, we used the PCC framework as per the JBI guide. So P stands for the participants. So we consider studies that include individuals like the academicians, researchers, students, mentor, mentee, and other institutions. And the first C stands for concept, that is the phenomenon of interest for this review. So we include studies and reports related to the health research mentorship only. That means we exclude studies and reports which are related to clinical and administrative mentorships and non-health research mentorships as well. And the second C stands for the context, and we consider the LMIC settings based on the recent World Bank classifications. So now we will move to the results section. So a total of 3,129 records were identified through electronic database and through other methods as well. And finally, a total of 77 studies were reported that fulfilled the inclusion criteria that we have set. So the final included studies were 77 studies. And when we see the characteristics of these studies, most of the included studies were from Africa and from LMIC settings, which include at least 2 regions based on the WHO regional classifications. And most of the studies and reports were, initiated and funded by the high-income countries. And when you see the corresponding author for the included studies, most, 50 is almost 50-50 or similar among the high-income countries and lower, LMIC settings. And if you see the mentorship status, the mentorship was done mostly by the high-income countries to low and middle-income countries. And now let's move to the thematic areas that are identified. And let's start with the approach, the activities or strategies and outcomes related to health research mentorship. So training workshops, discussion forums, virtual face-to-face meetings, webinars, and e-mentoring were some of the approaches which were used for research mentorship in LMIC, whereas the pairing or matching of mates and mentors, whether it could be in hierarchical or vertical form, and peer-to-peer or horizontal form, were some of the strategies used for research mentorship in LMICs. And mentorship outcomes measured by the increased number of abstracts accepted for oral presentation, published in peer-reviewed journals, getting research grants funded were some of the outcomes achieved by research mentorship in LMICs from the included studies. Now, let's see the other thematic area that we have identified, and these were related to barriers to research mentorship in LMICs. And these were some of the listed ones, and it includes like the lack of clarity on concept of the mentorship term itself, the roles and responsibilities of the mentor and the mentee. And sometimes there are also language barriers, challenges in matching the mentor and the mentee. And in general, there is also challenge or a barrier related to institutional and system-related challenges. So these were some of the barriers that we have got from the included studies. And the other thematic area that we have identified was the strategies related to enhancing research mentorship in LMICs. And these were some of the strategies that were mentioned in the included articles. And it includes like the tailored capacity development, addressing and respecting the diversity, ensuring the access to publications and scientific resources, institutional capacity building for mentorship, institutionalizing research mentorship, and etc. And now let's wind up the presentation with the following conclusion. So the scoping review identified that the health research mentorship in LMIs are limited, and few available evidence are initiated, funded, and led by institutions from high-income countries. And the scoping review also found that the health research mentorship in LMIs remains non-institutionalized, and it's in ad hoc state, which may have contributed to limited health research outputs from LMIs as compared to the high-income countries. And when we see the implication of the finding from this this review for practice, is that the outputs or the outcomes from the scoping review provides us useful evidence for the development of the practical guideline to institutionalize research mentorship in LMICs. And as it has been said before by Professor John, it was also integrated with other methods that are open call and the consensus building meetings that will be presented by the next presenters, of course. So finally, we would like to thank all the partners who were involved on this work, and I thank you.
Thank you, Joseph. That was very clear, and it's really helpful to ground this in a discussion of the evidence. Our next speaker is Dr. Anay Pakri. Dr. Pakri is going to introduce the crowdsourcing open call and the consensus development process that led to the practical guide. Over to you, Dr. Pakri.
Thanks, Joe. Hi, everyone. My name is Anay Pakri, and I'll take the next few minutes to talk about the open call and the consensus building process. So a brief of intro, we launched the crowdsourcing open call with the main purpose of soliciting strategies to enhance research mentorship in LMICs, which will ultimately inform the development of a practical guide. In terms of timeline, the crowdsourcing ran for a period of 6 months. So we had the launch and spent the next 4 months doing intensive promotion and dissemination. We received ideas. And at the 5th month, we sort of capped the deadline and reviewed the entries we received. We're able to notify finalists in the 6th month. So in reviewing and grading the submissions we received, we had the 5-point judging criteria, which was based on clear description of the strategies or the ideas, a potential for enhancing research mentorship in low and middle income countries, some degree of innovation, feasibility and suitability in diverse LMIC settings, and we're particularly interested in strategies and ideas that promoted equity and fairness in practice of mentorship activities. So looking at our results, we received a total of 60 submissions from the crowdsourcing open call. After screening, 46 of these were eligible, and we had 5 finalists. So a finalist submission is one that is really exceptional and was able to achieve a mean score of 7 or more out of 10. So we're graded on a 1 to 10 scale. It was a global open call, so we received most of our entries in English language. However, there were 6 Spanish submissions. In terms of engagement, we had more input from the African region. So our top participating countries were from Nigeria with 10 entries. We had 6 entries from Ethiopia and 3 entries came in from Malawi. We had a couple more submissions from other LMICs. So looking at the demographic of our participants in terms of gender, we had a good mix with 20 females and 26 males. Based on age, most of our participants were between 28 and 47 years. And looking at the educational level, majority were graduate degree holders. So we had 27 applicants with doctoral degrees and 17 applicants with master's degrees at the time of submission. So we went ahead to analyze all of the data contained in the open call submissions, and we're able to identify some key items and themes related to enhancing research mentorship in low and middle income contexts. And as you could see in bold fonts, these are our main findings. So having mentorship as an institutional responsibility, leveraging already existing programs and resources, the role of peer mentorship, so people at the same career levels, the role of digital tools, so social media, apps, mobile apps, and all of those in enhancing research mentorship, and also practicing a culture of generosity. So we looked closely at our results and were able to identify these three as sort of our main finding based on the volume of submissions contributing to this. So I'll spend a few more minutes talking about our key themes. Most of our submissions identified mentorship as a collective and collaborative responsibility, which should be expected and provided by all team members. There was the need and stressing the role of mentorship policies in guiding mentorship activities, and also how grants and ethics review committees should sort of consider mentorship as an integral part in reviewing research projects and funding applications. We had a good volume of submissions also pointing to leveraging already existing structures, resources, and programs. So partnering with your existing networks and collaborating to establish your mentorship activities, then utilizing already established training programs. A good example would be like a doctoral training program where you have the doctoral supervisor and the doctoral students having that mentor-mentee relationship. So delivering the sort of already existing programs, and then your networks, especially international networks, so expand your mentorship platforms. And there's also that bit about funding. So with research programs, there is the need for funds, and most of our submissions also identify the fact that you could very well incorporate mentorship into already funded programs, already successful grants, as opposed to waiting to apply for fresh funds. And then also we had a whole team on a culture of generosity. So there's a need for that holistic approach in the mentor-mentee relationship. This involves considering other social and cultural determinants of life and how it impacts on research outputs, being more respectful of diversity, being more inclusive, and overall protecting mentees from racial barriers and other negative critics. So we cleaned up the data from the open call and merged with the key findings from the scoping review, which Yosef presented a few minutes ago. And we're able to come up with a list of 35 key items focused on enhancing research mentorship in LMICs. Through an in-person meeting and 2 modified Delphi surveys, we're able to refine and further build these items, which later informed the practical guide we're launching today. So I'll talk more about the consensus building process. So we had 2 rounds of a modified Delphi process. Round 1 was based on statements from the scoping review and the open call. So we had 35 total items. We reached out to 61 participants and we received 36 responses, which gave us a response rate of 59%. And the good thing is we're able to reach consensus, which was greater than 80% agreement for all of these 35 items. We revised and refined these items and then launched the round 2 Delphi survey, which is an iteration of the first survey. It had 42 items. We reached out to our original 61 participants and we had 32 responses. We still had a response rate about 50%. And for the second round as well, we're able to reach consensus on all 42 items. So both of the surveys were hosted online. This brings us to our consensus meeting in Addis. So this was hosted by Ari and the TDR Global team. It was held in Addis Ababa, Ethiopia in the month of June. The conference really was to bring together the experts, participants, and members of the working group to sort of finalize the executive summary and key sections of the mentorship guide. So in terms of participants, we were 22 in attendance, including the steering committee members, the working group, and selected finalists. And at the end of the 2-day meeting, we were able to finalize the executive summary and also map out the key sections of the practical guide, which we will be learning about shortly. I'll stop here, but I'd like to say a very big thank you to all our partnering organizations and collaborating networks. Thank you too for joining us today. Over to you, Joe.
Thank you, Dr. Pakri. That was great. Our final speaker will be Dr. Murgisa Kaaba. He's professor of preventive medicine at Addis Ababa University, He worked at UNICEF before that, and he's been a really key leader in the development of HERMES. So over to you, Dr. Kaaba.
Thank you so much, Joe. It's a pleasure to be in this panel. My task is much lighter, given the fact that my colleagues have really talked about much of the processes that we have gone through. And my presentation basically is what we as a group have really came up with. By way of just providing the background, I think my predecessors have talked about research mentorship as a very important tool to improve the quality and effectiveness of research. And that has been the case basically in higher income countries, which unfortunately is not the case in lower and middle income countries. That's not really benefiting as much from research mentorship. And of course, as we see in lower and middle income countries, the quality and effectiveness of research outcome is not as great as it is in higher income countries. And of course, TDR has, taught institutionalizing research mentorship is really a great step to improve research quality as well as effectiveness. And of course, the purpose of this guide is to improve research mentorship in an institutionalized way in lower to middle income countries. And we actually partnered with TDR, our Arman Hansen Research Institute, of course, social entrepreneurship to spur health, and individuals that are that have been identified through the crowdsourcing open call that my colleague Annie has actually elaborated earlier. So I'm just summing up what my colleagues earlier have talked about. Of course, we've done a scoping review separate from crowdsourcing open call. But we brought all the results from those two processes in order to develop, as Ini has elaborated, to clarify the themes for the guide. Those themes have gone through the Delphi process to be deepened, and that has culminated in a consensus forum that was conducted in Addis Ababa. So as you can see, the practical guide development process have benefited from an iterative process at different level that has generated useful evidences. Having done that, then we basically drew basic principles that could be sought, of course, based on local contexts, but the basic ones that really serve as a foundation for this practical guide are recognizing intersectional disparities in mentorship. Obviously, as we see even in higher income countries, we don't see equity in mentorship, and obviously we want to really see equity in mentorship and consider a holistic approach to mentorship processes instead of really focusing on a specific element. Perhaps looking at it in a holistic manner is the way to go. Recognizing research mentorship as an institutional responsibility instead of bringing from elsewhere or top-down approach. Perhaps, if institutions really take full responsibility to institute research mentorship, that would really sustain and improve the capacity of research. We also believe that there is no, we are not starting from the scratch. There always are local resources. There always are available experiences which we can leverage upon, basing ourselves on a pay-it-forward culture where those who have been supported could as well support. His Excellency the Minister was talking about the current mentors used to be mentees, and therefore that pay-it-forward culture could actually improve research mentorship processes, and promoting peer mentorship, where the younger ones can as well play an important role. is critical, and capacity building in protocol development as well as involvement of IRBs is critical in order to ensure it takes roots, basically. Ensuring grant application factors and including costs for mentorship is an important step really to consider. And developing context appropriate plans, monitoring indicators and measurements on an ongoing basis are important foundation for research mentorship being instituted, and celebrating exceptional research mentorship within teams and having those as an ambassadors, as an advocates, and so on and so forth are critical elements. So those basic principles actually could really roll out with the basic components that somehow has been in a way touched upon by my colleague and me. So there are three fundamental components which has to do with research mentorship life cycle, which has to do with leveraging existing resources, and of course, institutionalizing research mentorship. It definitely is also about measuring the entire process. So each of those three, four components, if you like, have a specific elements. Within research mentorship life cycles, we have to really identify institutional champions for research mentorship. There is a component of encouraging small habits, experiences of routine mentorship that we can build on, benefit from, building peer research mentorship, defining common expectations between the mentor and mentee, and leveraging existing resources is about mapping existing resources within an institution. We are not starting from the scratch, definitely. There are smaller kind of experience resources that we can build on, and leveraging on ongoing funding, training grants, and the institutions. I mean, within institutions in lower middle income countries, obviously, there are ongoing research, ongoing resource funding resources, which we can tweak a little bit in order to really make sure this mentorship institutionalization could happen. Identifying existing expertise within the institutions, and leveraging available training grants, and embedding the research mentorship within the institution itself are critical elements. As I was saying, institutionalization is part of actually looking into the intersectional disparity, making sure equity is put in place, and considering a holistic approach for the research activities, and building collaborations with local institutions that have resources for that matter. So we can fit, for instance, within a particular country, there are different institutions with different kind of expertise, which we can pull around. So those elements have to definitely be planned succinctly in a concrete manner, followed, tracked, for implementation, and measured at the end of the day, so that we can celebrate the successes, tracking the system, improving the research mentorship processes. Translating this practical guide, institutions are basically required to do four most important tasks. Number one, exploration. What programs are there? What are existing experiences? What resources do we have within our own institutions, and who are the potentials within existing resources? That's a kind of mapping what exists within my institutions. That's quite critical. Once we map that, then we have to really prepare. We have to plan to launch mentorship program within the institution, identifying key people, organizational mechanisms, and accountability. Obviously, as we see within research academic institutions, there are researchers being supervised by seniors and so and so, but that's not really structured, that's not well organized. And therefore, in this preparation, it's a matter of really clarifying who is responsible for what and how to ensure accountability, and that could be measured at the end of the day. So implementation is the next important level, where we are matching mentees and mentors organizing, ongoing capacity building and tracking the progress, taking immediate measures as required in order to improvise, and then sustaining the process where we continue to improve the experiences, ensuring organizational support, and perhaps nurturing the paying it forward culture and, shedding light on what has been learned being shared with other institutions. By way of concluding, we are not starting from the scratch, obviously. Even if we are saying, yeah, there are limitations, there still are low-hanging fruits within institutions that could be mapped and considered for capitalizing on those and moving forward. The most important point is we have to act now. Acting now probably is saving much of the otherwise wasted kind of research resources in lower and middle income countries, and therefore using this guide and acting right now would actually improve a lot. But we are not saying everything has its own limitation. And of course, as we go implementing this guide, we need to also track how it is moving, how it is being implemented, what are the challenges in order to really improve the guide as we go along. So further research is also important to consider to take it forward. So this is the team that has actually participated in the consensus building face-to-face meeting in Addis Ababa. Great minds from different sources. I just, to end, I'd just like to take this opportunity to thank TDR Global for the initiative and those who really participated in the whole process, putting this guide together, and of course, the respected panelists as well as participants here that contributors to the refinement of the guideline. Thank you so much, Joe.
Thanks, Murgisa. That was great. Really excellent, helpful sort of clarification of what's in the guide. So now we're going to have a brief panel, and this is going to be very quick. Each panelist will have a single question that they'll answer. First, for our panelists, I'd like to introduce Professor Daniel Yeoma. He's at Jimma University in Jimma, Ethiopia. He's an internal medicine physician, an infectious disease researcher, and has a special interest in malaria and HIV. He was previously a TDR fellow and a member of the TDR Global Ethiopian node. Tell us, Dr. Yeoma, what is the state of research mentorship at your university?
Greeting all, and thank you, Professor Joe, for the introduction and also inviting me as a panelist on this important event. I actually have worked as a clinical mentor and also have been a research mentee and mentor while working in Jimma University. In general, regarding mentorship, in Ethiopia, we have witnessed the great impact of clinical mentorship in improving the HIV service and its contribution in reducing the HIV incidence. The reason for this is one, because the clinical mentorship was well incorporated formally in the HIV care and service, both at the institutional and the national level. However, looking at the research mentorship, as Joseph described, although there are pockets of ad hoc or informal way of research mentorship that have been observed in some research groups and at the individual level, there was no formal institutional research mentorship in Jimma University and most institutions in Ethiopia. Mostly at the institution, what we have been practicing was research supervision. However, these have laid very good platforms where undergraduate, postgraduate, and PhD students work together and supervise with a senior researcher. And there are also many research groups that have been created and that enhanced many national and international collaboration establishment in the institution. Jimma University has been labeled as one of research institution in Ethiopia by Ministry of Education recently. This has created a great interest in research mentorship at the institutional level, and various activities actually have been initiated this year. Besides, research mentorship has now been provided a priority at our institution to strengthen research capacity, quality of research output, and strengthen the health service. And it's currently being led by the Vice President of Research and Community Service of our institution. As most of the research mentorship guide and evidence generated and available resources are from high-income countries, and there are limited resources and experience shared in low and middle-income countries. This has been a really challenge to easily implement and expand research mentorship at the institutional level. However, our institution has started some initiative regarding research mentorship, including development of different research training material, and also listing and providing research trainings for mentees. Over to you, Joe.
Thanks, Dr. Yeoma. That was really helpful. For our next question, I'd like to turn to Dr. Barbara Castelnuovo. She directs the research department at the Infectious Disease Institute at Makerere University. She's led several research capacity building units and supervised many trainees. And Dr. Castelnuovo, if a colleague calls you from another university in Uganda and they're hoping to enhance research mentorship, what advice would you have for them? And I think there's a question in the chat and the Q&A from Peter Gumbo. It's really the same sort of, how do you start? Where do you start from? Over to you.
Thank you so much for the opportunity. So I would say definitely we have to accept the fact that it's complex to start building a culture of mentorship. I have to say you need to have, first of all, leaders in an organization that believe in it, or champions that start actually moving things. Now, the problem always is in our settings is really resources. And so I think that there are available resources, there are available training grants, but you also have to become very creative internally on what you are trying to do. So, for example, I heard before people talking about the mentorshipment cycle. That is very important. It is very important that you actually acknowledge that anyone at some point can mentor someone else. Any mentee at some point has some experience for which can mentor other people. So for example, with my students, I already encourage people doing their PhD to mentor master students, because at that point they should be able really to offer advice. So other important resources that you can leverage internally are peer mentorship groups. We do have several peer mentorship groups at the institute, where, for example, we encourage master students or PhD students to meet monthly. And this is really a very important resource, because they can really advise each other. Even when supervisors are very busy or not accessible, they always have a forum where they can exchange their experience. We also have actually this model for senior scientists. Even when you are a senior scientist, it may have that you don't have anyone above you that can actually help you or supervise you, because you reach that level. And so we also have a forum for senior scientists, so they can mentor each other. Finally, I think another important thing to start with is really you need to map your people. You need to map your people and map their skills. And people can have multiple skills. And even when you don't have a very senior person who is able to, for example, mentor junior staff, you can actually identify several people with skills that that staff needs. And doesn't have to be only one person taking the mentorship role, but one person can be the best to tell a student how to write. Another person can be the best person to teach a student how to use their time, and so on. So there are research skills, but researchers also need other skills, like how to learn to communicate, to deal with their supervisors, and these are also skills that you need to teach. And you often don't need a very experienced person for some of these skills. If you have a research ethics committee, or some institutes may have just a simple scientific committee that scrutinize proposals that are coming in. Make sure that these proposals always have a capacity building. I think really actually at our institute, that's how we started in 2004, requiring for anybody that was coming from outside, not just to come, carry on a study and then go, because you're leaving behind clinicians that participate in that study, you're leaving behind staff, and they are entitled to learn why they are actually working for a particular research project, so that next time can they actually write their own research project. So it takes really long, I have to say. It's not a matter of taking 6 months or 1 year, but you know, just you can start really with baby steps, and eventually I think you can stand by your own, start writing your training grants and as more funding. Thank you. Over to you.
Thank you, Dr. Castelnuovo. That's really helpful advice, sort of how to get started, and those are some really nice ideas to get things cooking. Our next panelist is Dr. Tilak Chandra Nath. He's an associate professor at Sylhet Agricultural University in Bangladesh. He was a TDR fellow in implementation research and was one of the finalists identified through the global crowdsourcing open call. Dr. Nath, you've started several mentorship programs and sustained them through some really creative methods. Could you tell us a little bit more about how you've used crowdfunding and other approaches to support research mentorship in Bangladesh?
Greetings to all of you from Bangladesh. Thank you, Dr. Joe, for introducing me and giving me the opportunity to talk in this platform. And today I am also very happy to see Professor Reader. Last month we met during ICOPA 2022 in Copenhagen. So I'm very happy to see all of you in this today. I am now working as a faculty in the Sylhet Agriculture University, and I am also selected as a board member of World Society of Parasitology and representative South Asia. So I hope by using this, I can use the research mentorship program in future also. Research mentorship is still considered as a new concept in Bangladesh. A very few organizations are concerned regarding mentorship, and as far as I know, no institution has funding for mentorship right now. I can say that there are almost no practice of research mentorship in Bangladesh. The reason behind this may be there is no known funding for research mentorship, as well as the idea of mentorship is not promoted properly in Bangladesh. As I engaged with TDR since 2016, I got some idea of mentorship during my study, especially my MPS study. As I am concerned about the benefit of mentorship, especially in lower middle income countries. So after I finished my MPS, when I returned back to Bangladesh, I try to implement some small scale mentorship program in Bangladesh, especially in my university, mostly engaging the young people in the community. Now our ongoing mentorship program focusing on neglected tropical diseases, health education, and implementation of citizen science approach. Our mentors include the university faculty, scientists, and the professional from diverse background, especially from clinical side and also from environmental and veterinarian. Our mentor we have mentor now from 5 different countries, including India, US, Australia, and South Korea. We know that to continue any program, we need such kind of financial source. As we have no fund, I think to raise some fund from alternative ways. It is not really very formal, so you can say all are on informal way. So I engage our university to fund our mentorship program. I request them actually, and I success to get a small fund by name of Social Welfare Fund from the university. I hope almost all university in lower middle income countries, they have a small fund from social welfare, so we can use this social welfare fund if we want to use it for mentorship program. And also, I raised some fund by engaging, by arranging some cultural program by our mentor-mentee, where the viewers need to buy ticket by paying a small amount of money, and we raise this money for doing some other activities for our mentorship program. Another source of our funding, including selling the souvenir. So our mentor and mentee, they prepare some souvenir and we sell the souvenir to the local people and also some other people by small money. Also, we communicate some higher position professional in Bangladesh. Those are the corporate official and also the government official. And we ask them for some donation for our mentorship program, and we get some money also. So by using those kind of uncommon source, we started the approach for implementing research mentorship in Bangladesh. But again, I note that all of those are very informal. And now I look forward to start the formal mentorship program by utilizing our toolkit, which we are going to launch today.
Thank you, Tilak. Our final panelist today is Dr. Michael Mihoot. He's the unit head for TDR Program Innovation and Management. He's been involved in many innovative programs to spur research mentorship and LMICs. Dr. Mihoot, could you tell us a little bit more about what are some important innovations in research mentorship? What's new or different, and how can we leverage this in building organizational capacity for mentorship?
Sure, thank you, Joe. Well, if you want to hear the answer to that question, you have to read that guide, but I will make it easy for you. So I think, the essence is the same. The essence is that there is a human bond that between the mentor and mentee, and the mentor offers to guide the mentee to grow his or her career and to become who they dreamed to be. That's the essence. That's the and then there are the flavors that come on top of this, and the innovations that we have today. There are several. There is the fact that, for example, we want to make this mentorship institutional, to create a framework to make it more sustainable. And I think this is an important element that this guide is bringing. It's not just case by case, people mentoring each other, but it's how we can support this environment to be more conducive to career progression through mentorship. Another one that we can benefit from in these days is the digital tools that we have now, and we can do this thing remotely. We don't need to write letters and send them by the post. So it's so much easier to take advantage of the current platforms and to pilot new platforms to put people together and that they can develop this mentorship relation. And of course, accessing to networks. I think this is one of the strengths that an institution can offer, that it provides access for the mentee to a network which is local, but also it can be international. And TDR Global is one of those platforms that we will invite you to use. And I think Joe posted a link in the chat there. Thank you.
Thanks. And just for a few final remarks, we have Deputy Director Alemseged Abdisa, who's really been a key leader in this whole process of developing HERMES. Would you like to share a few final thoughts, Dr. Abdisa?
Excellent. Thanks, Joe. Thanks, everyone. First of all, I would like to acknowledge the opening remarks done by Professor John Reader and Dr. Samuel, highlighting the need to enhance mentorship in LMIC in settings where resources is limited, and encouraging colleagues to use the practical guide, so which is important. So getting the practical guide done is one thing, but implementing and piloting the practical guide is another challenge. So we are really looking forward to work with everyone and get feedback to improve the practical guide. And thanks to all speakers, Dr. Inni, Murgisa, Yosef, Michael. It has been great. I mean, it has been a wonderful journey to work together on this practical guide. As you know, we use two different approaches, the scoping review and the open call. Really great approach to gather important lessons and practice all over the world to introduce into the practical guide. And thanks, Joe, for facilitating this panel discussion, and also thanks to the panelists, because you really gave us a good insight to move forward with the practical guide and in institutionalization of research mentorship in resource limited settings. Last but not least, to the participants, all of you, for your time and also for the questions and comments and feedback. And we encourage everyone to take part in the event to promote use of the practical guide in resource limited settings and send us feedback so that we can produce the next version after getting insights and learn from the implementation of the practical guide. Thank you, everyone, and thank you, Joe, for the opportunity. Over to you.
Thank you. Really delighted, as Dr. Abisa said, go to the website, check out the practical guide, critique it, think about it. How could this be used in your local setting? Let us know. We're really excited to collaborate, excited to disseminate this. And I think we underestimate the power of so many local communities. There's a lot of local resources, champions, great ideas, research grants. We've heard today about practical strategies, open access resources. I'm really optimistic and delighted to be with you here today. So thanks again to everyone for joining us, to Professor Reeder, to Minister Kifle. It's been a great opportunity. Thank you.
Thank you very much.
I need to head into the hospital, but that was great. Thanks, everyone.
Okay, thank you, everyone. Thank you. Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Bye.